And so after all this suffering with daily migraines or so, I thought, and was getting nowhere, I finally hear an expert talking about how it's a common misdiagnosis for this. Hello, welcome. I am so happy to have you here. My name is Jenny if you're new, and if you're returning, welcome back. Thanks for being here. I hope you're all having a great week. I am in a series. If you're returning, you know that I'm in a series on my headache disorders related to Ehlers Danlos Syndrome. If you're new, I'm in about a 7-part series. It keeps increasing. I said 5 at first, now it's 7. It'll stop at 7, but and I'm talking about the headache disorders that I have with Ehlers Danlos Syndrome. And so tonight I am talking about my experience with spontaneous CSF leak. Now, I should say that I do not have currently, I don't carry this diagnosis anymore, but I did for over 1.5 years, close to 2 years, and went through a bunch of different treatments, a bunch of different diagnostic procedures, and met incredible people within the CSF leak community. And so that's why I wanted to share that, and because spontaneous CSF leaks are not as rare as they are believed to be. They are more common, and we really just there's so many people suffering with these. We need more awareness. So yeah, so if you've never heard of a CSF leak or spontaneous CSF leak, basically your brain and spinal cord are bathed in cerebrospinal fluid. The fluid is held inside layers of connective tissue, and they're called meninges. Well, the outermost layer of your meninges is called the dura, and it's generally a tough connective tissue. However, if you have a hereditary connective tissue disorder, or say you've been injured, you can develop a hole or a tear within the dura where the cerebrospinal fluid leaks out. So, hence the name. And so when you can imagine if your brain and your spinal cord is being cushioned in this fluid, if it's leaking out, if you don't have enough of it, the impact that your brain is going to take a hit every time, from impact, walking, life, and your spinal cord too. So there are lots and lots of symptoms that can happen, and lots of complications as well. So there are 3 different types of leaks. The first one is iatrogenic, and it is going to be because of a needle. So say an epidural during labor and delivery, or an epidural steroid shot, say you get from a pain management doctor or something of that nature, or a lumbar puncture. So iatrogenic is just, it can be traced back to a needle, is the way I look at it. Traumatic is the result of an injury, so a head injury, concussion, neck injury. And a spontaneous, which is what I was diagnosed with, it occurs with minimal to no precipitant, no clear precipitant anyway. So like, I've been in 2 car accidents, but my symptoms didn't start immediately, the day after or anything like that. So they're looking for like a direct, it would be like with trauma, it would start immediately after. So spontaneous, that's what that is. And so it could be something even like a calcified intervertebral disc that can puncture the dura, or a bone spur that can puncture the dura. That's still classified as spontaneous. So the common symptoms that you can experience are headache, that is worse when upright and better when horizontal, but other patterns do occur. So the longer that you have had this, the longer you've had the symptoms, the positional aspect can disappear and not be as prominent. So where you would have, say you began developing symptoms right after an epidural, and it was just immediately better when you laid down, if it goes on for years and years or long term, you may lose that positional aspect altogether, making it a little harder to determine or let your doctor know that it's a positional headache. Also common symptoms are nausea and vomiting, neck pain or stiffness, sense of imbalance, change in hearing, so that could be muffled hearing, ringing in the ears, or it could sound like you're underwater. pain between your shoulder blades, sensitivity to sound, sensitivity to light, nausea and vomiting, dizziness and vertigo, changes in cognition, so brain fog. So a lot. Now some less common symptoms would be visual changes, so blurring, double vision, changes or visual field defects, facial numbness or pain, a strange taste in your mouth, so like maybe metallic. A lot of people have reported that. Pain or numbness at various nerve root levels below the arms, fatigue, and even galactorrhea, which is fluid discharge from the nipples. So it's just, I mean, you can see all these random and crazy symptoms can occur. Now, some rare signs or complications can be quadriplegia, dementia, Parkinsonism or other movement disorders, ataxia or unsteady gait, stupor, coma, cerebral venous thrombosis, stroke, death. So it can be very severe, very, very serious. So if you're having these symptoms, your doctor will want to obviously work you up, see if you might possibly have this. And the way that they will do that is by an MRI. It can be an MRI. An MRI could show brain sag, so it could definitely show that your brain is not being supported and cushioned the way that it should be by your cerebral spinal fluid, and therefore it is sagging. And so they'll, excuse me, I'm sorry, I'm having trouble swallowing today. MRI without contrast and CT myelogram are the most common. And CT myelogram is actually how mine was diagnosed. It involves an injection of radiographic contrast into the intrathecal space via lumbar puncture, followed by a CT of the spine. An opening pressure may be measured, and CSF may be collected for analysis. And so they will sometimes go off your opening pressure, but it doesn't exclude it if your opening pressure is not terribly low. They'll go off the whole picture. So in my case, also dynamic CT myelogram is also used, and digital subtraction myelogram. I've also had that. I couldn't have the MRI because of my neurostimulator. So anyway, it wasn't clear, leak wasn't clear on my imaging, but there were 2 suspicious areas, and my doctor had explained that is quite frequently the case with spontaneous leaks, that they're not clear and you just have to go after the suspicious areas. So I had an area in my cervical spine and my thoracic region, and he just elected to go. I had already done the conservative symptom management, which I'll tell you what that is. Bed rest, horizontal positioning, oral and IV hydration can provide temporary symptomatic relief. Oral and IV caffeine can provide temporary symptomatic relief. Oral theophylline, questionable benefit. Steroids, questionable benefit plus risk, so it's rarely recommended. A use of an abdominal binder is recommended, and a lot of people with leaks find help with abdominal binder. You can buy them in a medical supply store, or even like a pharmacy, CVS. I think you can get them there. So for nausea, they would suggest ginger products, or you could try oils, or they could write you something prescription like Zofran. For pain, it would be non-opioid analgesics, opioid analgesics sometimes, complementary approaches like nutrition, supplements, and mind-body techniques, acupuncture. So those are considered conservative symptom management. Those things had failed in my situation. Before I had even seen Dr. Carroll, I tried the conservative measures. So he suggested an epidural blood patch. And what that is the patient's own blood is injected into the epidural space. And they can take your blood from your arm. Mine was taken from my jugular, because those of us with Ehlers Danlos have cruddy veins. And they just put it back in through injection to the area that they're suspecting, to the areas. He did both of the areas he had suspected in my case. And so the idea is that it goes into that I can't talk. I'm sorry, guys. Epidural epidural space, that's the word I'm looking for, and will ideally form a patch over that dura where there is the hole or the tear. And for a lot of people that works, especially I've heard with iatrogenic leaks. So, you know, where there's a cause and it's more likely that they're going to be able to locate it. Now, not all people that have iatrogenic leaks, you can locate it that easy, but anyway, I think they're more beneficial in those types of situations for people that have connective tissue disease disorders. It's not going to be as likely that that's going to work. So they will move to fiber and glue patching. And that's just what it says. Same thing on just they don't have to take your blood because it's glue. It's a sealant. So they'll inject it into the suspicious area and hopefully it will form a patch and seal it. And for a lot of people, that's all they need. I mean, I think probably for the most part, either blood patches, I think for the most part work for most people, then fiber and glue for the most part would work. If those measures fail, then of course surgery would be suggested, and that would be as a last resort. So, but there is very few, in fact, I believe at this time there's only one center in the US, maybe two, that do the surgical repairs for leaks. So really, I mean, there's just not enough awareness within the medical community, and imaging is not caught up. So it's very difficult to identify leaks. And so there's so much suffering can go on, and so much trial and error trying to locate it and treatments. And I personally underwent 2 different blood patches and 6 different fiber and glue patches, just trying to locate the leak to see if I could get benefit. So that's traveling, that's across the country. So it's not easy. That's why I share. There's also a lot of crossover in symptoms between conditions. In my case, mine ended up being this instability. However, it was very hard to say because I hadn't yet had the imaging because I was waiting to get in with the neurosurgeon for the instability. We went after the leak first, and all of my other imaging had come back normal. So there was no reason to believe that it's a long story, and I've talked about it in other videos, but my whole point is because of the crossover in symptoms, not only with instability, but with migraines, with occipital neuralgia, with fibromyalgia, Parkinson's, chronic fatigue, so many different conditions, it's just really important to put it out there as a possibility. That's why I share. And the doctor that treated me at Stanford is very passionate about sharing and spreading awareness, so that people that have been misdiagnosed can get properly diagnosed if this is in reality what's going on. So I wanted to share, just in case you're somebody who is undergoing treatments for whatever it is, say it's daily migraines and you're not getting better. If you're having any of those symptoms and you're not getting better, you might consider this and try the conservative measures first. I'm not telling you what to do. I'm just saying, like, if you're somebody that's searching, and if you're watching this, I'm assuming you're having some health issues. So what I like about it is you can start with the conservative measures and take it to your doctor and ask for it to be ruled out and work from there. So, but I just think it's helpful because we don't have a cure for migraines, for example, and this is curable. It's treatable. It may be difficult to treat. It may be difficult to cure, but to know that there is that's available to me is really hopeful. So I just had to share in hopes of maybe reaching somebody out there who's lost hope, that's really at the end of their rope as far as treatments and options that are available. So this might be an option. I've rambled on for too long. I'm going to get off here. If you have any questions, feel free to drop them below, and I'm happy to answer them. If you suspect a leak or if you've been diagnosed with a leak, I would love to hear your story. Please comment below if you feel comfortable, and thank you so much for being here. I'll see you next week. Bye.